Good afternoon. It's a sincere pleasure to join you at this wonderful conference. We were here last night. We had some great food, and you Polish people definitely know how to party. It's a real pleasure to share with you some of my experiences utilizing fractional radio frequency technology for a specific dermatological indication, in this case active acne and early acne scars, but we'll also delve a little bit into more complex acne scar revision. And obviously, acne scar revision is a multimodal approach that requires combinations of many energy-based devices and many tools, but I'll situate a fractional radio frequency within that spectrum. I am a plastic and reconstructive surgeon. I'm from Palestine. I am global key opinion leader for InMode Technologies, which produces a lot of these bipolar radio frequency tools. I'm also a certified clinical expert with Mertz Aesthetics, and I'm a faculty at several institutions of aesthetic medicine, and I'm also the international coordinator for IMCAS Alert, and I'm a faculty at IMCAS in France as well. I'm going to take 2 seconds only to plug in the IMCAS Alert service. This is a free service available to physicians from all over the world within aesthetics, cosmetic surgery, dermatology, lasers, and energy-based devices as well. You can join and have discussions, share your complications, and have input from a variety of colleagues from around the world. So, acne. Why is a plastic surgeon talking to you about acne? Because the end result of acne is acne scarring, which can be quite disfiguring. And acne scarring, although many dermatologists do a great job with it, and we learn a lot from each other, is also a surgical disease. And therefore, it's a challenging disease and one that requires a lot of creativity, patience, and thinking outside of the box. The reason I put this picture here is because there are two theories as to the origins of acne. One major theory is that our sebum was upregulated when we left the water onto land, and that this has been crucial in allowing our skin to resist the environment, the sun, cold temperatures, etc. The other theory is that it's really there just for the birth canal, that human beings have a very difficult time coming out of the pelvis in a woman, and that the sebum that's present in skin tends to facilitate birth, and that it just is a remnant that stays on after this. Nevertheless, more and more, we're not thinking of acne as just a disease of adolescence. It's no longer something that you see only in your teenage years and then you're cured. It's actually a chronic disease that waxes and wanes, and in over 55% of adult patients, it waxes and wanes for the rest of their life. When we are treating these types of acne presentations, we cannot definitively say that we have cured the disease. We think of the disease in terms of long-term remission and trying to reduce relapse to a maximum. And a secondary and very important goal is to try to prevent scarring and treat the early acne scars as soon as possible. I'm sure this room is full of many dermatologists and aesthetic experts. I'm not going to spend a lot of time going over the pathophysiology of acne. We're still learning more and more about it. Suffice it to say, it's not simple and it's multifactorial. And historically, we always used to think that it was associated only with P. acnes, which we've renamed now into C. acnes. Not necessarily. If you take most acne lesions on the face and you culture them, 50% of them are sterile. There's no bacteria. And so there's a very strong element of autoimmunogenicity that's active in this disease as well. And we don't really know what the absolute cause is, but we know that the source of the disease is in the sebaceous gland. And this is where this particular technology, I think, plays a very powerful role in that it can target the sebaceous gland and ablate it. This is how we think about it today. If you want to use your traditional means for acne treatment, like isotretinoin, which can be a very powerful tool, you're going to face three problems. The first problem is it won't work in a third of patients. So about 33% of adult patients are not going to respond to isotretinoin. 55% of these patients who received the high doses of isotretinoin are going to relapse within 5 years. They're going to get the acne back, and sometimes it's even worse than it was before. And lastly, isotretinoin in and of itself, due to the fact that it's targeting the inflammatory lesions at an early stage, may reduce certain acne scars, but only at around 30%. Morpheus, on the other hand, which is the technology that I'm going to be introducing to you as an acne indication, and is in the process now of receiving the FDA approval for this indication, you only get 0.1 out of 3, as opposed to 1 out of 3 that don't respond. Relapse is 10% as opposed to 55% in 5 years. And early scar prevention as well as treatment ranges between 60 to 90%. Morpheus can be a painful treatment when higher energies are used, and therefore you need to have a very good approach for topical anesthesia. There are many topical anesthetics you can use. There are many tricks. The method I have found to be the most effective is taking a tumescent solution, which is a mix of normal saline or Ringer's lactate with lidocaine and adrenaline, and then injecting it using this multi-injector needle. It's painless. It takes only about 5 minutes to anesthetize the whole face, and it actually provides a wet environment for the radiofrequency signal to travel in, which makes it a more effective treatment. So you can see here, this multi-injector needle with the little meso needles on it can be used very, very efficiently to provide necessary anesthesia for the treatment, and it reduces bruising as well, and you get no bleeding during the procedure. This paper is about to be published in the Journal of Cosmetic Dermatology, which is edited by Michael Gold. This is the paper that I had the honor of authoring, and it provides the different kinds of depths and energy levels that we can use in order to target acne specifically. Morpheus has several different tips, and we tend to use the standard 24-pin tip for the face in order to treat acne. And we can also use other tips called resurfix. This is a tip that is only 0.5 centimeter. It's fixed. It doesn't vary in depth. And we use certain energies to try to target the more superficial early scars. This is a patient who we did put on low-dose isotretinoin. So low-dose isotretinoin is sometimes used, and it tends to provide a synergistic effect to these energy-based devices. She was on it twice a week only. So there was no need for any lab tests. There was no need to monitor the liver enzymes. She didn't have any of the side effects of isotretinoin. She was quite comfortable. And we performed 3 Morpheus sessions spaced 2 months apart. And this is her remission, and she has been having this remission now for several years. Also very, very safe and extremely effective in the darker skin phenotype. In this particular patient, no low-dose isotretinoin was used, just a topical retinol, Epiduo, which is a benzoyl peroxide and 3rd-generation retinol adapalene together. She used that topically for a year, and she had 3 Morpheus sessions using specific parameters spaced 2 months apart. Here's another one, also a dark phototype. And you can see how effective the early scar remodeling that we can achieve is. She's wearing, by the way, laser goggles, because this was just before we did the Morpheus. She received the laser treatment for a body indication. But we took the photo, and then this is her after 4 sessions that were spaced 2 months apart. Here's another one, low-dose isotretinoin, twice a week for 8 months, 2 Morpheus sessions spaced 2 months apart. What is phenomenal is you don't only get improvement in the acne, but you also get a structural improvement in the tissue. This patient did have no hyaluronic acid injections, no injections whatsoever, just the Morpheus sessions. And she's young, and as the inflammation cleared, it seems like her fat and soft tissue rehydrated and lifted. Here's another one, low-dose isotretinoin, only 2 times a week for 8 months, 3 Morpheus sessions spaced 2 months apart. And now the next step for her will be some face tide to improve her lower third, but that's different. This is one of the more challenging cases. I believe, just having treated so many patients like this, that had she not received the Morpheus technology, she would not have been able to accomplish such a scar load reduction. I think that she would have had worse scars had we not intervened with the energy-based devices. This is 1 session only. It's very, very safe in darker skin types. This is 3 Morpheus sessions spaced 2 months apart. This is 3 Morpheus sessions as well with the low-dose isotretinoin. This patient did actually receive an injection of Radiesse, and she did have prior treatments using other energy-based devices for facial tightening called Ulthera, but I want you to notice how the Morpheus actually improved her acne, especially in the lower third, in the chin. She actually failed isotretinoin 2 times. She's a skin type 5. I come from the Eastern Mediterranean, so we have actually some populations that are of African origin. She's originally Nigerian, and she presented to me with a very, very difficult acne that just didn't respond to anything. We did 4 Morpheus sessions and we got her to this. She only used topical tretinoin because she had failed isotretinoin before. Even in cystic kind of pictures, you can get a very, very nice reduction in the skin quality. Even with conglobata pictures or abscesses, you can get a very nice reduction with scar prevention as well. She underwent 3 sessions. She used no isotretinoin, just the topical tretinoin. I wonder if she was that compliant. But this is a very, very powerful tool, and it's able to improve skin texture and to lift the tissues as well. This patient received absolutely no filler. This is just 2 Morpheus sessions. You get a significant improvement in the skin quality, in the lift, and in the matrix of the skin. And you can see the acne in remission. This is 2 Morpheus sessions to put her acne into remission, and then the next step for her will be scar revision. I don't want to dwell too much on the scar revision because there is no single technology that's going to be able to solve all of the acne scars that we note, especially the tethered rolling scars with adhesions, but I'll be able to at least take you through some of the strategies that we use in order to achieve these acne scar improvements. There is a strong role for fractional radiofrequency with this, but you have to combine it with other tools. You have to combine it with subcision to release the tethering, fully ablative lasers in some cases to provide the superficial resurfacing, TCA or phenol crosses, biostimulation with my favorite is diluted Radiesse. You can get very, very nice results with this. And I'm going to take you very briefly through some of these technologies. So in this case, I felt that the fibrosis was quite superficial. It was mostly in the dermis. I didn't have to enter very, very deep into the fat. So I used the 22 gauge 70 millimeter soft fill cannula just to break some of those bands. Sometimes that's not enough. I have to use a much bigger cannula. This in this case is a 16 gauge cannula because the fibrosis actually reached the subcutaneous layer. And this is just a little bit of tumescent with breaking down of the scars. And then sometimes I have to be even more aggressive and use what's known as a V dissector or a Taylor liberator. So we fill the face with tumescent and you very, very gently use this V dissector to try to separate some of this dermal fibrosis in order to provide for collagen remodeling. And this very, very effective tool, even when you want to combine energy-based devices with this procedure. So it's extremely important that you not rely on one particular energy type, and you have to think of acne scar revision as being a combination of several tools together. So you just make a small nick on your way out, and then you can insert this V dissector and very, very gently release the scarred tissue in order to create new space for collagen remodeling. Okay, so this gives you an example of how it's done. The patient is not feeling any pain. She's completely tumesced. Okay, and then you can obviously start to introduce some other technologies as well. For example, this is an Accutite probe. It's part of the InMode Morpheus portfolio. And Accutite is an internal bipolar radiofrequency. And what you can do is you can actually go into that skin immediately after you have done your subcision and provide internal radiofrequency heating, which actually results in excellent scar remodeling as well. This is obviously the Morpheus and the different parameters that we set in terms of depth and energy, and there are specific protocols for each aspect of this. This, of course, is in combination with an ablative laser. You can go right into the dermis to deliver this energy, and then just a few results of acne scar revision utilizing Morpheus in addition to some other tools. You can see excellent, excellent improvement, even in some of the more challenging, very, very adhered and tethered scars. And the key, the last message I'll leave and I'm finishing, is make sure you get your acne under control. Do not attempt acne scar revision if acne is still active. It has to be completely in remission before you can perform excellent acne scar remodeling. And this tool is really a safe and excellent one that should be in the armamentarium of any doctor, not just for treating acne, but also for facial rejuvenation. And it's, of all the machines that I've tried, the one I've settled on for this purpose because of its extreme safety and incredible power. This was also in combination with diluted radius to treat some of the atrophy there. Thank you very much for listening, and I appreciate your time, and looking forward to speaking with some of you after the lecture. Sorry to be over.